Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Welcome to the Totally Adequate podcast. I'm Kate Deiters, and today we're talking proposed rules. We have two rules on the docket: the proposed rule for Medicare Advantage organizations and a new California proposed assembly bill that would set provider directory accuracy benchmarks for health plans, ultimately aiming for a 95% accuracy rate by 2029. To help us understand all of it is our resident expert, Snyder, VP of Government Affairs at Quest Analytics. Zach, it's great to have you here.
Yeah, thanks for having me and looking forward to talking about these policy items today.
Let's start with the proposed rule for Medicare Advantage organizations. Zach, can you give us some insight into how these new rules compare with previous proposals and what key aspects we should be paying attention to?
Yeah, so unlike the Notice of Benefit and Payment Parameters, which was proposed in the Biden administration, this one was also proposed. It was not finalized prior to the administration leaving. It had a comment deadline, and many different organizations did submit comments, including Quest Analytics. But in the proposed rule, there were several areas worth our time as a network adequacy organization to really dive into. And one of those pieces relates to the Medicare Plan Finder. And this is a really interesting proposal from CMS because what they're proposing to do is to require the Medicare Advantage organizations or the health plans to submit provider directory data to populate Medicare Plan Finder. So today, individuals can use Medicare Plan Finder to compare plans, compare MA plans on benefits and other things like that, but they can't compare based on networks. And so they're going to require the health plans to submit their provider directory data to Medicare Advantage, and that will be used to populate Medicare Plan Finder so that consumers can compare and contrast. And this really could be an opportunity for Medicare Advantage inside CMS to align with some of the other things that they're doing related to provider directories, in particular, the RFI that was released some time ago about creating a national provider data database, so to speak. And we did see that CMS began a pilot of that in one state.
We often talk about improving the healthcare consumer experience. That could be everything from what is their experience when they're trying to find a plan, to purchasing their insurance, to being able to access healthcare services in a timely manner. And the idea of bringing more information into one location to help them make some of those decisions sounds like it would be beneficial for them. It will be interesting to see the comments that CMS receives from other organizations in the industry. Also, we'd love to know from you, our listeners, is this something that you think would help the consumer experience? Let us know in the comments below. Another change CMS is proposing involves amending its network adequacy exception request rationale framework. Notably, they plan to eliminate the justification related to provider contracting statuses, remove the other category, and recategorize the rationales that currently fall under it. For more information, make sure to read our blog post and visit our Medicare Advantage resource hub. All right, Zach, moving on to the second proposed rule on our docket, we are going to talk about the newly proposed California Assembly Bill 280. California is known for being one of the first to implement more stringent provider data accuracy requirements. What do we need to know about Assembly Bill 280?
California, this legislative session, did introduce a new bill, Assembly Bill 280. This bill, or a form of it at least, was defeated last year. And it's back now. But what it would do is it would require the commercial health plans in the state of California to demonstrate to the Department of Managed Care which is the agency in California that oversees most commercial health plans, that their health plan directories are at least 95% accurate by 2029. So the legislation would require the department to establish a methodology and a process to ensure the accuracy of the provider directories. This would include creating a source of truth in the state so that the health plans can compare their directories against that to meet that 95% accuracy goal by 2029. In addition, the legislation would require that provider claims be a part of verifying accuracy, both on the health plan side and on the department side. So provider claims will be a big part of determining whether or not you meet that 95% accurate mark by 2029. So the legislation is high level. If it were to pass, the department would do significant rulemaking on it to flesh out the exact requirements here. But this would be a big deal. We've never seen a state issue a percent of accuracy before, and it could be a marker of where policy goes in the provider directory accuracy space.
Like you said, we haven't seen something this specific in terms of accuracy requirements before. There are a few states exploring the idea of having an incremental improvement. For example, a 2% increase in data accuracy every couple of years. But setting a definitive benchmark like 95% accuracy by 2029, this is a whole new level. Zach, I'm curious, have you heard of similar initiatives or ideas in the conversations that you're having with other states right now?
We've seen other states explore creating statewide provider directory databases for the purposes of network adequacy, but not explicit policy like we're seeing in California that would require a percent accuracy and then give explicit authority to the department to enforce fines against the plans that don't meet that. CMS right now is working with the Oklahoma Department of Insurance on a pilot to do that right now. The Minnesota Department of Health, which oversees QHPs, issued an RFI just a few weeks ago to develop a statewide provider directory database for the purposes of network adequacy as well. So those are two other states that are doing something similar, but it hasn't been packaged with a stick approach, how they're, both carrots and sticks in policy. Yes. But there's no stick against the health plans in any of those efforts right now. And I'm not sure if they would think about that in the future.
Right. With many states working on implementing provider directory accuracy programs, it will be interesting to see if more of them adopt similar enforcement measures. And of course, Zach, we will have you back so that you can keep us in the loop on any updates.
Yeah, we will. We're tracking everything that's going on across the states, across the federal government, and we'll continue to update listeners here and update our customers and others through other things that we put together throughout the year.
Excellent. Thank you so much, Zach, and thank you everyone for tuning in. We will be back next month with more updates. If there are any network adequacy or provider directory accuracy policies you would like us to cover on the podcast, let us know and we'll add them to our docket. Until next time, I hope you have a fantastic rest of your day.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate podcast is produced by Fowler House Films and Quest Analytics. Thank you for listening.